How is your intestine? Is everything okay, or have you noticed anything different? Today I will explain to you in a very simple way the 5 warning signs of bowel cancer, also called colorectal cancer. This is a super important topic because, look, this type of cancer is the 3rd most common and the 2nd biggest cause of death from cancer in the world. Can you believe it? According to INER, Instituto Neurochirurgia Ortopedia Rehabilitaco, it is responsible for around 10% of cancer deaths. But calm down. The objective here is not to scare anyone. I want to help you understand the signs your body can give when something is wrong and what you can do to prevent it. Furthermore, I will explain what polyps are and why so many young people, under the age of 50, have been diagnosed with this cancer. So, stay with me until the end because this talk can literally save lives. Oh, before we start, leave your like here on the video. Did you know that this helps YouTube show this content to more people? And, if you can, share it with your friends and family. Your help can save lives. Who knows? Maybe you'll make a difference to someone today. And tell me in the comments. Do you know someone who has had bowel cancer? I want to know what part of the world you are from too. What are the 5 warning signs? 1. Change in bowel habits. Do you know what your normal bathroom rhythm is like? Some people go right after breakfast, others once or twice a day, and there are people who only go 2 or 3 times a week. And it's okay, each body has its own rhythm. But if you notice that this has suddenly changed and continues to change, pay attention. This could be a sign that something is wrong. Changes in bowel habits are common as we age and, most of the time, it's nothing serious. But if these changes are persistent or getting worse, it's best to see a doctor. Around 65% of people with bowel cancer notice some change in their bowel movements. One of the most common signs is diarrhea that doesn't go away after a few days, for no apparent reason, or constipation, the famous trapped intestine, that comes and goes. And this may include stools with different consistency, harder or very soft. Change in color, very dark or even reddish stools. Going to the bathroom more often than normal or, on the contrary, not going for days. 2. Blood in the stool. It may seem like a strange topic, but it's super important to pay attention to what you see when you go to the bathroom. Did you know that the large intestine is divided into parts? There is the ascending, transverse, descending, sigmoid colon, and then comes the rectum and the anus. Depending on where the problem is, the type of bleeding may be different. If the problem is on the right side of the intestine, ascending colon, this side is larger, and the stool is more liquid because the intestine is still absorbing water. When the tumor appears there, it may not cause obstructions. That is, it does not block the path of feces, but it may bleed slowly and steadily. This leaves the feces a very dark color, almost black, looking like tar, what we call melena. And yes, the smell is very strong. Now, if it is on the left side, descending or sigmoid colon, this side is narrower, and the stool is firmer. Here, the blood usually appears very red in color, as if it were dripping into the toilet or toilet paper after a bowel movement. But not all blood and feces is cancer, okay? It could be something simpler, like hemorrhoids, fissures, small cracks in the anus, or even something harmless, like eating beetroot, which makes the stool reddish. However, you shouldn't ignore it. Why would the tumor cause bleeding? It can ulcerate, form a wound in the intestine. It may bleed due to a small vessel that was feeding the tumor, or even the effort to evacuate, which increases the pressure in the intestine and makes a more sensitive point bleed. The most important thing here is not to guess. If you see blood in your stool, don't be scared, but see a doctor to investigate. It may not be anything serious, but it's always better to be safe than sorry, right? 3. Belly pain. Just imagine, you've never had pain in the abdominal region, but suddenly you start to feel those strong cramps, which come and go without explanation, or even pain when going to the bathroom. This can happen if something is affecting the rectum, such as a tumor. But calm down. Not all pain is serious. It may be that you ate something that gave you gas, or perhaps you are overdoing the fiber in your diet. This can also cause abdominal discomfort. Now, if nothing has changed in your diet and the pain continues unabated, it's best to investigate. Don't be afraid to go to the doctor, because this pain can be an important warning that something is wrong in your intestine. The sooner you find out what it is, the better, right? Remember, your body always gives you signals, and taking care of it is the first step to staying well. 4. Fatigue and constant tiredness. You know that tiredness that doesn't go away, even after resting? It's not the kind of tired because you didn't sleep much or had a busy day. It's a tiredness that lasts for weeks, sometimes even a month, and it feels like something is draining your energy. What could be happening? In the case of bowel cancer, this tiredness may be caused by hidden anemia. The tumor may be bleeding very slowly, without you realizing it, and this is leaving you anemic. Even those who eat well and do not lack iron in their diet can suffer from anemia as a result. It is something that needs to be investigated. Another possibility: cancer cells, as they are always growing quickly, use a lot of your body's energy. Plus, they could be robbing you of the nutrients you need, leaving you exhausted all the time. So, here's a tip. If you feel this strange and prolonged tiredness, don't ignore it. The body is trying to tell you that something might be wrong. 5. Abdominal swelling. Do you know when your belly seems fuller or more bloated than usual? This could just be gas or something you ate, but it could also be a warning sign. Why does this happen? If there is a tumor in the intestine, it may be obstructing the passage of food and liquids or even partially blocking the path. This causes gas and feces to build up, causing that uncomfortable bloating. This accumulation can even cause more constant cramps or pain. So, what to do? There is no need to despair about any swelling, because several things can cause it, such as foods or changes in diet. But if the swelling or pain is frequent or different from what you're used to, it's best to see a doctor. Keep an eye out and take care of your health. What are polyps in the intestine? Imagine that the lining of the intestine is like the wall of a very smooth tunnel. Sometimes, some little balls, called polyps, can grow in this tunnel. They are like small bumps that, most of the time, don't cause any problems. But what if something goes wrong? In some cases, these little balls may undergo changes in their DNA, as if something in them got messed up. When this happens, they can turn into something more serious, like cancer. How long does this take? Look how interesting. Generally, for a polyp to turn into cancer, it takes a long time, around 10 years. This is why it is so important to have tests such as colonoscopy, which can detect and remove these polyps before they become a problem. Stay tuned. Taking care now can avoid complications later on. Why are some people more likely to get bowel cancer? That's a very important question. Let's go. There are some things that can increase the risk, and some of them we cannot control. I'm going to tell you in a simple way the 3 most common things that increase the chances of developing this cancer. 1. Age. 2. Inflammation in the intestine. 3. Genetics. These are factors that you cannot change, but knowing this is half the battle. The sooner we take care of our health, the better. So now, what can you do to reduce your risk of bowel cancer? The good news is that there are things that depend solely on you. These are lifestyle changes that make a huge difference to your health. Let's talk about the 5 most important ones. 1. Quit smoking. 2. Decrease alcohol. 3. Exercise. 4. Weight maintenance. 5. Eat real food and less fast food. Now, a super important point. Take preventative exams. If they find a polyp in your intestine, your doctor can remove it before it turns into something more serious. Oh, and the colonoscopy. It's quick. Lasts 30 to 60 minutes. It is essential for preventing and detecting intestinal problems. So, if your doctor recommends it, don't delay. Your health will thank you. Did you like the video? How about sharing with friends and family? This way, more people can learn and prevent themselves. Oh, and don't forget to subscribe to the channel to continue receiving health tips. See you in the next video and thank you very much for being here.